Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics and emergency medicine, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our Health Talk today is about holistic medicine. Joining us today as our guest speaker is Dr. Grace Patterson, who is a family practice physician at Southfield, and she's going to highlight our viewers for what is holistic medicine, what are the general role of holistic medicine in clinical practice. So, good morning, Grace, and welcome to my show.
Doctor, thank you so much for having me. It's a privilege and an honor.
I know we have been talking for such a long time, but we couldn't make it for some reason. So, before we get started, can you give your introduction to our viewers?
Yes, my name is Dr. Grace Patterson, affectionately known to most as Dr. Grace, your favorite doctor. I like to say that. And I've been in practice for over 28 years now.
Is that so?
Yes,
okay.
Yes. And I had various jobs from, as you know, early coming in your career, from urgent care medicine and things of that, home care. That's when I started my own practice. I would actually be out in the field. And in the inner city, I did house-to-house apartment buildings, seniors and group homes, and that's where it all began. And then I went into practice for myself for a little over 11 years now, 100% working for myself, an entrepreneur. And I got exposed to holistic medicine in medical school. It was one of my electives in my fourth year. And I was very intrigued by it. And ever since I was exposed to that, I actually looked at it and incorporated it in my practice and helping my patients along the way.
So that's good, because holistic medicine, in other words, what it is, correct me if I'm wrong, non-pharmacologic treatment of the individual who are suffering from mental depression and other issues, right?
Exactly. And so there's a Eastern and Western. The holistic, you have like the acupuncture, those type of modalities and things of that nature. But my approach is holistic with a W, where we treat mind, soul, body, and spirit. And we do believe there's a place for allopathic and alternative medicine to work synergistically together. And so for every medicine, we know it depletes the body of something. Yes. So what we do is on any type of modality that we use, let's just use, for example, high blood pressure medication, an old school one like Lasix or something.
Right.
We know that depletes the body of a mineral, which is potassium.
Right.
So we replace it. So that's just an example of type of things that we do.
So, that is, I did a lot of reading about this also, was because couple of webinars I have done about the non-pharmacologic approach. Also in the children, adults, and certain conditions like chronic migraines, all those things. So basically what it is, mind-body syndrome, right?
Right.
And you try to correct the mind.
Right.
So what is the trends to promote living longer? What are the recent trends?
Okay, right now is maintaining muscle mass is one of the trending things that is happening right now. They know, as we know as doctors, the biggest organ of the body is the skin. But they're saying now maintaining muscle mass because your muscle is a great metabolizer. It's the first line that metabolizes the glucose. So as we get more mature, we decline in muscle mass. So therefore, you're decreasing your metabolic rate.
Okay.
So that's why it's important to make sure that you're not only eating right, but make sure you do some type of resistance and strength training to help to keep your metabolic processes in the body going, which in the long run helps with longevity.
Yeah, so in other words, for our viewers to know, the basic principle is to increase your muscle strength, right?
Yes.
Whichever way you can by exercises and all those. So basically, that is the area that improves the circulation.
Absolutely, because working out is, as people should know, helps with cognitive,
right?
With the circulation, as you said, brain health, the metabolism, as I just shared with you, and also, when people fall, they want to be able to get up to have that core strength to get up.
Right.
And so if they don't, that old commercial, I'll fall and I can't get up. And so muscle health and muscle strength is very important.
Very important for holistic medicine, yeah. So now let us talk about what are the general principles in pain management. These days there's so much of opioid epidemic.
Yes.
Every time I open the TV, CNN has reported this and that, and I did so much research work. I have sent a couple of articles for the journals also.
Right.
I don't know if they will accept it or not. What I do is when I send it to one journal, if they accept it, I'm happy. If they don't, then I try to redo it and send it to other journals about the opioid, fentanyl, opioid. Those have become the epidemic, the topic of the day. So could you highlight our viewers about what are the principles in pain management? And now you mentioned about opioid, right? Pain and opioid and the epidemic, right?
So what
exactly this is what the current issues are.
Yeah, so how I started, like I told you, I was doing home visits in the inner cities, and a lot of my patients were on opiates, and I was like, what's going on here? And so I started doing my research and started from a holistic approach, and so we have a stringent guidelines for people to be accepted in our practice.
Right.
So you have to have imaging within the last 2 years. You have to have no history of drug abuse within the last 2 years. We review your MAPS, which is a system where we check to see how many doctors you've seen or how many scripts that you have gotten. We want to do a urine drug screen to make sure there's no illicit substances. But we also teach our patients, if you eat good, you feel good. If you eat bad, you feel bad. I have had a patient, she was in her late 30s. When I met her, she was on a walker, a feeding tube, and she also was on a fentanyl patch and oxycodone. Yes. So we finally got her weaned off the patch. She's no longer on a walker. She no longer has a feeding tube, but I really do believe the combination of the patch and the oxycodone paralyzed her gut. And so now she has what we call a gastric pacemaker. But right now she's doing very, very well. She was like on 120 tablets. We got her down to 60 to 90 because she goes through a lot of procedures. And so when she on her procedures, we go up on her dose, but we back her down. And so along with education, she exercises now. And everybody in our clinic knows if you eat poorly, it increases inflammation, it increases your pain. And a lot of patients that are part of our clinic said no one prior to coming to our practice taught them that.
But then tell me about the gastric pacemaker. That's very interesting.
So let me...
I know I read it about this, but I want to hear from the specialist like you.
Okay, well, I'm not a gastroenterologist, but my patient happen to have it. And so what it does, it's like a heart pacemaker that signals the heart to beat. But for the gut, your gut has what we call peristalsis, as you know as a doctor, where it's a slow gastric motility as you eat. It moves the food along until it's digested, until we excrete it out.
Okay, so this pacemaker, usually they touch the outer layer, the serosome layer of the intestinal tract, right? But because that's where the nerve bundles are.
Right, exactly. And so as you know, opiates it slows gastric motility.
Oh.
So I had shared with my patient, I think since you were on such heavy opiates, the fentanyl and the oxycodone at the same time, I think it probably paralyzed her gut. And so we're working diligently now as we have been weaning her, working with her gastroenterologist to see, because we got her off the feeding tube. So our next goal for her this coming year is to get to get the pacemaker.
Maintain her daily intake of whatever she eats, maintain her weight and all that.
Yes, and she's doing great.
Oh, that's very good, because that's what we need these days. We have to get rid of all these pain medications that they are. And this is the principle of holistic medicine, right?
Exactly. Developing a rapport with the patient is number one. And another criteria part of our practice, they have to have some type of psychotherapy on board.
Right.
Because
I was going to ask you, that was my next question about the psychotherapy.
Yes, because the thing is, we ask our patients, are you really treating pain or are you treating your emotions? Being in inner city, dealing with, the things of life, just everything, things, especially during COVID. A lot of my patients lost family members after family members being isolated and those type of things, and to be rebounding from that, it's a mindset to want to get better. And so along with me coaching with them and developing a rapport with them, letting them know that we really do care, we have been able to wean the majority of our patients from 120 tablets to 90 tablets down to 60. And I do
slow and gradual, because you don't want them to have the withdrawal reaction.
Yes, absolutely. And so, and we have those conversations, after we, especially a lot of them in the cold months, because the cold increases the pain, as you probably already know.
Right.
But when the spring and fall come, the spring and summer comes, we have those conversations. Okay, we need to start cutting back maybe 1 or 2 tablets at a time. Yes.
Yeah. So now, there are so many tools for everything, like managing fall. 100, so many articles have been written, how do you handle preventing fall, especially, for the elderlies.
Right.
Yeah, and then there are tools for the obesity crisis.
Oh my goodness.
And everything has been written there also. So tell us about what are the tools for obesity.
Okay, so part of my pain management is also weight wellness, because if a person is heavy, especially their spine and their back has to carry the weight.
Exactly.
So we promote them, okay, you got to eat right, you got to get your body moving, and so we can shed some of the pounds. But what's trending right now, as you know, is the semaglutide, the peptides, the skinny shots, the Wegovy's, the Ozempics, and things of that nature, which people have to realize is not a magic bullet.
Right.
It's a tool to help you to change your behavior and your relationship with food. So after you maintain or meet your goal, then you've already changed your mindset and your behavior in relationship with food, so you can maintain the goal of the weight reduction that you have obtained. I like to use weight reduction or weight release. I don't like
body mass index, BMI.
BMIs and things of that nature. Those are very important in regards to signifying the increase of high blood pressure, diabetes, renal failure, those type, and you increase your risk of cancer, of being morbid or overweight for long periods of time. And so I just had a conversation last night with one of the CEOs at Blue Cross Blue Shield, and they said this last year they spent, I think I want to say $1.1 billion in covering those drugs for weight loss, and they are fuming about that, and to the point where they said January 1 that they're gonna stop covering it.
That is true.
And in my head, I'm like, well, sometimes you have to pay the piper for long-term benefits. In my head, I'm thinking if you have a population of people that are more healthier, that won't have the cardiovascular event of heart disease or a heart attack because they're obese, or become diabetic and lose a limb or go into renal failure, that you would want your population of people, the demographics that's under your insurance, to be weight well, so long term they would not have those complications, which causes more money as well.
I know.
But I guess we're just doctors.
Yeah, even on the television, every time, all those medicine that they're advertising to lose weight, they will say different pictures of the obesity.
Before and afters, right.
Before and after, what do you think about that?
Well, I think that those can be motivating, but I've been doing this for a long time now. If a person's mindset is not there.
Right, mind and
Again, which is a holistic approach. If they're not there mentally and emotionally, you can take all the medication, you can do all the shots, you can,
do whatever you want.
But if they're not there mentally and emotionally, it's a real challenge. But I've been doing it for so long, I can almost tell it's like a shift in their emotions and their conversation and their demeanor and their confidence. You're like, you're going to make it.
Right. Yeah. So, you know what? These are all cousins: obesity, diabetes, high blood pressure. Of course, malignancy is a little different from that.
Right.
But I don't think there is any correlation. So far, they have not established that obesity is linked to particular particular malignancy. I don't think it is, right?
No, it's not. But they said it increases your risk.
It increases the risk, in women, the fibroadenosis of the breast and all those lump that gets not diagnosed. So that could be the factor, right?
Right. And then, adipose tissue also helps increase estrogen production.
Right.
So,
estrogen. So that's very good, yeah. So now let us talk about the burning topic of these days, the current status of healthcare.
Oh my goodness.
That is a very burning topic.
It's a burning topic, especially post-COVID. A lot of
post-COVID, right. We haven't touched the COVID, but now my next webinar is going to be RSV and the COVID together.
Oh,
the
wow.
virus. And, the new vaccine that is coming up from next month, I think.
Yes. So I think the culture of medicine has been impacted greatly. Especially in the hospital setting. There's a lot of contractors or floating nurses, traveling nurses, where they are not employed by the hospital. So there's really no camaraderie, or there isn't really any allegiance or culture anymore in the hospital. I'm here to do a job, to get my check, and I'm gone.
Right, yeah.
And the short staff, no one is talking about the shortage of staff that is happening. You could have a nurse, but they need supportive care. And when they don't have that supportive care, the nurse not only has to dispense meds, but do
other things.
I
know. It's very hard once you're in the hospital.
It's very hard. It's very, very hard. And so one of the things that we do in our practice, we make ourselves available for our patients. Of course, I'm like, if you have shortness of breath and can't breathe, go dial 911. Just go ahead and go. But if you have a fall or something like that, I do have a mobile unit that I can send someone out to do an X-ray, to do an EKG, to do an echo in the home, and make an assessment or send a nurse to see if they need to go to the hospital, because I'm trying to prevent them from having increased
emergency room visits. Yeah.
Absolutely. And that's another thing too, that patients need to understand, that your emergency room is not your doctor's office.
Right.
It's not a doctor visits. Emergency rooms is for life-threatening ER.
Yeah.
Urgent care is different. An urgent visit is like, I need attention right now, but it's not life-threatening. And so a lot of people use the emergency room for urgent care and for their primary care things, and it's not the place for that.
No.
So we try to make sure we screen our patients and let them know that we're available to make assessments before they actually get in the car and then go to an emergency room. I had another patient just tell me I sat there for 5 to 6 hours and nothing helping, and they just walked out.
Yeah, more billions. So, my background is pediatrics and emergency medicine and urgent care. When I work at the emergency room, there are so many injuries, so many mild cases that could be easily sent to the urgent care, right? But then when I'm at the urgent care, I get sometimes real life-threatening things. And the reason being, when the people don't have insurance, they don't have insurance for their health care, and when they go to emergency room, things get done. So there is always a dilemma: emergency room versus urgent care, or go to the private physician like you.
Right.
So it's like a triangle.
It is, and it's about education as well. And them being comfortable in knowing that wherever they go, they should be treated with dignity, treated with respect, and make sure that they get what they need regardless to their insurance status.
Yeah. So now last question, what is concierge services?
Okay, concierge services is basically what I call coaching services, or having higher access to your doctor.
High access, okay.
Yes, then you would make an appointment, and your appointment is like maybe 3 months away, and whatever you're dealing with, you have to deal with it until that time. Concierge services allows you to have access on a personal level with maybe even a cell phone, where you could reach out to your doctor and say, hey, this is going on. What do you think? What are your thoughts? What can I do? Same day services, that type of thing. The doctor can actually go to your home, those type of things. My concierge services that we provide does that, but we do a lot of holistic things too that we talked about before. IV infusion therapy with vitamins. We do blood testing to see what your non-traditional ones. We check and see what your B levels are, your C levels, and things like that. In a traditional setting, you might get a B12 and maybe a vitamin D. But with the concierge services, we do a lot of more extensive things, even checking amino acids, probiotics.
Do you give magnesium also?
Yes. And
because this is coming up a lot about the magnesium deficiency.
Yes, absolutely. That is also can be infused as well. And so, magnesium is very significant too right now.
Calcium, magnesium, and of course sodium.
Yes.
Yeah, because in the elderly population, there's so much of low sodium in the body, giving rise to all the symptoms, right?
Exactly. Well, as people mature, they don't cook as much. They eat what's convenient, those type of things. So they will be deficient in, things, as you said, like the sodium and especially the magnesium. I'm glad you brought that up. Very much so.
Because I've been reading about this magnesium thing, magnesium deficiency.
Right.
Not so much in the children, but in the senior citizens.
Right, that makes sense.
Yeah, magnesium deficiency. So, would you suggest just one tablet, one vitamins for people like senior citizens age group that they should be taking that will supplement them with all the minerals? I know Costco has Centrum Silver.
I've heard so many stories about Centrums, that Centrums are not highly absorbable, that they have a more placebo effect than anything.
Is that so?
I would recommend a liquid vitamin versus any capsule or tablet.
Vitamins?
Just any type of liquid vitamin, really, because it has a higher absorbency. Believe it or not, old school, and I hate to say this, but old school Geritol really works.
Exactly. Right.
Yes, because it's liquid.
But because liquid absorbs faster.
Yes.
Those tablets are so big.
Yes, they're so big, and but anyway, there is, if anyone wants to get in touch with me, I like to get an assessment of a person. I don't like to make general statements and say, hey, this may work for you, and it may not.
Right.
It just only could be a recommendation, especially after I make an assessment of the eating habits, exposures, and other medications too.
Sure.
So, especially when you're talking about elderly, they can be on a plethora of medications,
Right.
and
There's
then
a
you
whole
don't.
bag of medicine. You don't even know which one.
Right, will interfere because just because it's a vitamin, let's be clear, vitamins can counteract certain medications too. And let's say, for instance, I just use this as an example too. Like if you're on a blood thinner,
Yeah, right.
you need to avoid
certain foods.
certain foods.
Exactly. Yes.
And these foods are good foods.
Right,
Like you're
yeah.
supposed, when you're on a blood thinner, you're supposed to avoid the spinach, and anything dark
and
green and
On the other
leafy.
hand, if you have a renal colic, another story.
Right.
So you know what? This thing never ends.
It never.
Never
You're
ends.
right. So just because it's good, it may not be safe for that particular individual.
Right. So the bottom line is, after all the talk about holistic, the bottom line is stay healthy, watch your diet, maintain your weight, yeah, and do exercises and yoga. We didn't have time to cover those.
Right.
But what is your keynote 1 minute advice to our viewers, because we are running short of time?
Wow. One of the things I would like to say first and foremost, hydrate
Hydration.
and
right.
listen to your body.
Right.
I mean, that you live with you more than I do with that short little window that you have with your doctor.
Yeah.
And if your doctor is not listening to you, and this is what I say too,
Yeah, then seek
go
for
somewhere
somebody
else.
Yeah.
Yes, you shouldn't have to force someone to listen to you
Right,
and to
yeah.
what's
Go
going
to
on with your
somewhere else.
I'm a doctor, so
Sure, yeah.
I am encouraging you to find someone that will listen to you
Sure, yeah.
and listen to what is going on with you. And the more you
listen.
are in tune with yourself, your doctor is to work with you as a team.
Right.
You're
But
supposed to be a
always have
team.
options.
So
I like to thank you for coming to my show. I myself learned so much about holistic medicine. I'd like to thank our viewers for watching me today on my health talk. The topic was holistic medicine with our guest speaker, Dr. Grace Patterson. And until I see you guys again, have a wonderful fall and winter. Thank you so much. Thank you again. Thanking my producers, my video camera people for helping me prepare these wonderful videos. Thank you again.